Here are 4 USMLE-style questions focused on genetic disorders by chromosome, including Patau syndrome, Wilson disease, retinoblastoma RB1, and BRCA2. Question 1. A newborn is diagnosed with Patau syndrome, trisomy 13, after presenting with severe intellectual disability, microcephaly, polydactyly, and cleft lip palate. Which of the following genetic abnormalities is most commonly associated with Patau syndrome? A. Trisomy 21, B. Trisomy 13, C. Translocation of chromosome 13, chromosome 9 deletion, E. Chromosome 17 mutation. Answer B. Trisomy 13. Explanation. Patau syndrome, trisomy 13, is caused by the presence of an extra copy of chromosome 13. This syndrome is characterized by severe intellectual disability, polydactyly, cleft lip palate, microcephaly, and other congenital malformations. It is one of the trisomies that can be detected via karyotyping or other genetic tests. Question 2. A 30-year-old male presents with progressive hepatic failure, neurologic symptoms, and Kayser-Fleischer rings in the cornea. He is diagnosed with Wilson disease. What is the underlying genetic defect responsible for this disorder? A. Mutation in the HFE gene. B. Defect in ATP7B gene on chromosome 13. C. Deletion of RB1 gene on chromosome 13. D. Trinucleotide repeat expansion in the FMR1 gene. E. Mutations in the BRCA2 gene on chromosome 13. B. Defect in ATP7B gene on chromosome 13. Wilson disease is caused by mutations in the ATP7B gene on chromosome 13, which leads to impaired copper transport and copper accumulation in the liver, brain, and corneas. Kayser-Fleischer rings and neurologic symptoms, such as tremors and dystonia, are classic findings. Question 3. A 7-year-old child is diagnosed with retinoblastoma after presenting with leukocoria, white reflex in the pupil. The tumor is found to involve both eyes, and genetic testing reveals a mutation in the RB1 gene. Which of the following is the most likely inheritance pattern for this condition? A. Autosomal dominant with incomplete penetrance. B. Autosomal recessive. C. X-linked dominant. D. Mitochondrial inheritance. E. Autosomal dominant with complete penetrance. Autosomal dominant with incomplete penetrance. Explanation. Retinoblastoma is most commonly inherited as an autosomal dominant disorder with incomplete penetrance. The RB1 gene mutation on chromosome 13 leads to retinoblastoma, and individuals who inherit one mutated allele have a higher risk, though not all will develop the disease. Question 4. A 35-year-old woman with a family history of breast cancer is tested for a genetic mutation. She is found to have a mutation in the BRCA2 gene on chromosome 13. Which of the following cancers is she at increased risk for? A. Lung cancer. B. Ovarian cancer. C. Colorectal cancer. D. Liver cancer. E. Prostate cancer. Answer B. Ovarian cancer. Explanation. Mutations in the BRCA2 gene on chromosome 13 significantly increase the risk of developing breast cancer and ovarian cancer. BRCA2 mutations are associated with a higher risk of both early-onset breast cancer and ovarian cancer, with the lifetime risk for ovarian cancer in women with a BRCA2 mutation being notably increased. These questions